how to diagnose and to follow up a patient with iron overload with regards to transplantation. This is an important issue because there's a lot of literature around it. To begin with the easier one, serum ferritin, and let's say overall iron evaluation through serological tests. It's the easier one. You can have it on a daily basis, not a big deal, but clearly this kind of test may be influenced by other factors such as infection, inflammation, and so both pre-transplant and post-transplant with the risk of infection, graft versus host disease, serum ferritin may not be accurate and just only reflects the iron overload. But it's maybe one of the easier way to do so, and it's available worldwide and cheap. The other big test to follow iron overload, which is more reliable than serum ferritin, is the use of MRI. Both liver and cardiac MRI can be done serially before and after transplantation. And these are the tests that are maybe the more correlated with iron chelation efficacy and maybe the more specific one. So I think it's a test that can be done both as a workup pre-transplantation and maybe during the follow-up of transplantation. When to do it, it's a big question. I think that in the first months following transplant, it's maybe not useful, as there's so much things to do at that time. But after maybe the first 100 days or first 6 months, then you can think about getting back to this test and see how things are going for the iron overload, especially as these first 100 days or first 6 months are the one in which patients are the more likely to be transfused and heavily transfused. So it's important, I think, to have workup and some evaluation after this first months of transplantation. There's other tests that can be used. You can think about cardiac echography, for example. It's easy to use, but you have so much potential interfering causes that we cannot only rely on this to have an idea of the iron overload in that case. On a daily basis, you can also follow LFTs to see how things are going, but here again, like for serum ferritin, there's a lot of interfering factors that can be a problem for following just thinking it's iron overload. When we think about the evaluation of iron overload, it's a comprehensive workup, and we cannot put on the side the serum markers like LFTs, serum ferritin, maybe BNP for the heart, and the imaging with liver MRI and cardiac MRI. You need to consider any of these different tests at the same time. So it's a comprehensive workup and a complete workup that you need to do if you want to do something correct when you're evaluating iron overload, I think.